Welcome to our educational talks for cardiac rehabilitation, Swansea Bay University Health Board. We have a selection of different topics, all related to helping to guide you in your recovery following your cardiac event. The first topic that we are going to cover today is the anatomy and physiology of the heart. Disclaimer. This presentation should be used for general information purposes only. It is not a substitute for specific medical advice from a GP, specialist, or other healthcare professionals and should not be used as such. For individual cardiac rehabilitation advice, please consult your local cardiac rehabilitation team. If you are experiencing any changes in symptoms, please seek advice from either a GP or specialist. In the event of severe chest pain or breathing difficulties, please dial 999. The heart is made up of strong muscles that work like a pump, sending blood around your body continuously. The heart muscle is about the size of your fist and it sits in the middle of your chest, tilted slightly to the left. Your heart beats around 100,000 times each day. This continuously pumps, on average, about 5 litres of blood per minute around your body through a network of blood vessels called your circulatory system. This blood delivers oxygen and nutrients to all parts of your body and carries away unwanted carbon dioxide and waste products. Your heart and circulatory system works together to deliver blood to your organs so they can function. The heart needs a constant supply of blood, like every other living tissue. This supply comes from the coronary arteries, which branch off from the main artery, called the aorta, as it leaves the heart. The coronary arteries spread across the outside of the heart, supplying it with blood. The right coronary artery supplies blood mainly to the right side of the heart. The right side of the heart is smaller because it only pumps blood to the lungs. The left main coronary artery branches off into the circumflex artery and the left anterior descending artery and supplies blood to the left side of the heart. These arteries are about the size of a small drinking straw. The heart is made up of 4 chambers and 4 sets of valves. When we look at the heart diagram, we have the right side and the left side of the heart. Deoxygenated blood is what has circulated around your body and has used up most of the oxygen. It returns to the right side of the heart through the superior vena cava and the inferior vena cava. From here, the blood flows into the right atria through the tricuspid valves. Valves act like gates that open and close, making sure that your blood travels in one direction, just like a one-way traffic system. Once the blood flows through these valves, it then enters the right ventricle. From here, the right ventricle contracts and pushes the blood through the pulmonary valves into the pulmonary arteries, which transports the blood to the lungs to pick up the oxygen. This oxygenated blood enters the left side of the heart via the pulmonary veins. The blood flows into the left atria through the mitral valves and into the left ventricle. From here, the left ventricle contracts and pushes the blood through the aortic valves into the aorta, which is the main artery leaving the heart, and into the arteries to the rest of the body. The left and the right side of the heart is divided by a thin muscular wall called the septum. This prevents the mixing of the oxygenated and unoxygenated blood between the 2 sides of the heart. If you wish to do some further reading or find out what other educational material is available, please refer to the following websites. Thank you for watching. If you do have any questions, please contact your local cardiac rehabilitation team.